this is quite habitual. I don't deny it. Our next speaker is Shahid Shah, who is the CEO of Netspective. I have worked in the trenches with Shahid. We've co-spoken together before. I consider him a kindred spirit when it comes to open data, data portability, and the need to have a more open healthcare system. I talk about it in terms of strategies, context, and business models. Shahid is actually going to be the guy who will tell you how to actually make it happen in terms of getting the electrons and the wires to actually connect. He knows far more about that than I do. Anyway, someone who I respect a lot. Take it away, Shahid. We're happy to have you here. Thanks for coming.
Thanks, Vince. All right, so my job this afternoon is to pop a few bubbles, maybe around healthcare disruption, and get back to what I call actionable innovation. Many of you are probably coming from either innovation shops inside your company, or you're coming in from entrepreneurs, or you're just interested in the industry at large. And so what I'm going to try to do is to give you a sense of how big the healthcare market is and where we should focus on innovation. And so you've already heard a lot this morning, great stuff about where wireless and mobile and everything else is heading, but hopefully I'm going to give you a little bit different viewpoint on how to think of that from the innovation and entrepreneurship perspective. So I'll skip over who I am. This presentation, by the way, if you want access to it, it's up at all of my presentations I do is up at speakerdeck.com/Shah. So this is up there now. If there's anything on there that you like, you're welcome to grab it. What I'm going to try to cover today is the size of the market and why disruption in healthcare is actually a lot harder than we think. And to understand that, just try to imagine what $1 trillion looks like. And everything that you see up in gray up there is $1 trillion. $1 billion is that little thing in red. Now, whatever you think that is important in healthcare that you're going to go disrupt, you're just not going to do. You'd have to affect, and there's 3 of these trillions in our healthcare industry. One of those billion, if you could even get $1 billion out of whatever idea you have, it's a big deal, right? But it's not a disruption. So one way to think about it is, it's completely okay to have a great idea in healthcare that is focused on a very narrow but very important topic and yet not disrupt healthcare. Doesn't mean that it doesn't have a lot of value. So I work with a lot of startups, probably on the order of 50 to 100 startups a year for grant programs in government, all the way through to entrepreneurs, etc. And I was just telling somebody this morning that if I hear one more time what do you do as a healthcare startup? Well, I'm about to disrupt healthcare. No, nothing you do is going to disrupt healthcare, but it's okay, right? First and foremost, nothing, absolutely nothing that you're going to do, nothing that the government can do can disrupt healthcare, so nothing that you can do can disrupt healthcare, but it's okay, you don't have to, right? The second way to think about this is, whatever little mobile app you have, sophisticated data structures you're going to create, the coolest device, which I've worked on many medical devices, nothing that you do in there is going to disrupt healthcare. But it's okay, you don't have to. All you have to do is add a little bit more value here, add a little bit more value there, extract something from this place that's not coming out, and push it to somewhere else. It's okay to not be disruptive in healthcare. The next one to think about is, however you want to incorporate doctors, you're not going to be able to do it. However you want to incorporate patients, you're not going to be able to do it. But you can do it with 10 doctors. You can't do it with all of them. You can do it with 100,000 patients. You can't do it with 10 million of them or 50 million of them. But it's okay. You don't have to. You can just start with small slivers and go with that approach. This last one here is, we often focus and say, you know what, if only the existing medical device vendors, or if only the existing electronic health record solution vendors would simply put my super cool, great idea into the clinical workflow, everything would be great. Well, let's be realistic. Nobody gives a crap about your software. Nobody gives a crap about your device. They're not going to install it into clinical workflows just because you asked them to. Why? Because you're asking them to take on new legal liabilities. Why would they do it? Why would they take on something that's going to make their product less competitive potentially, and give them more heartache. It's just not going to happen. Second item there is, the other reason they're not going to do it is, they're not going to allow competing devices to come in without finding a way to get paid for it. So as you're thinking through all of this, and your brilliant idea, and your great mobile app, and you've got a nice platform that you're building, try to think through and say to yourself, do I need to disrupt healthcare, or something much, much smaller? And so that's what we're going to concentrate on for the rest of this talk. Here, in the device-focused world, what you want to think about is, what is the true innovation, what I call actionable innovation, are you working on? So actionable innovation has to be, and I kind of kid us in our market here, where it used to be that innovation in healthcare meant that you cured something. Now let's just think about that. Healthcare used to cure things. When was the last time we cured something? It's been a while, right? So what do we have to do? We have to take whatever else is left over now and call that innovation. And so think about these two areas. Innovation area number one is that you're doing something for physicians to make their diagnosis, therapies, etc. better, or you're doing something to patients to directly impact their healthcare. If that's the case, then you've got some innovation. So I'm going to run through real quick. This is a preview of a couple of things that I'm going to talk about in my talk tomorrow morning. It's at 8:15 in the morning. I don't know if you guys will be awake, but we'll chat about this a little bit. Is what kills us today is very different than what killed us even less than 100 years ago. And so we have life expectancy going up, which is good. It used to be that about 100 years ago, back in the 1900s, bacteria was the thing that killed us most. Today, however, it's mostly infections. If you look at, now in the case of most infections, we've got most of them beat, but there's still a couple of them, such as the flu, for example, that's still causing us grief. So why are these things important? If you're not looking at the trends of what's going on in healthcare when you're doing your innovations, you're really not doing any innovating. You're building something that you want to build and hoping that it's going to fit somewhere, as opposed to looking at the problems and going down that path. So look at the top killers today. 100 years ago, we were looking at a variety of different things. Today, heart disease, cancer, chronic lower respiratory diseases. So whatever your innovation is, better be concentrating on the things that are killing us today, because that's the first place we're supposed to be concentrating. Now, up here, we look at this age distribution. 100 years ago, we used to die at pretty much equal age groups. You see that on the left-hand side. It's a little bit hard to read. But the key thing to look at is the total number of deaths, whether you were young or old, was about the same. Now we're seeing most deaths occurring at the much later rates. Why is this important? Well, I mean, if you're trying to produce these innovations, this is where you have to go focus your efforts. Now, in here, there's been a talk about what business are we in? Are we in the life improvement business? Are we in the health business? So New England Journal of Medicine had a nice little article, I think it was a few months back, talking about the business of health. And if you haven't, and the reason why I gave this reference, if you go to speakerdeck.com/Shah, slide 16 has this. I'd recommend everybody read this. Because once you recognize what business you're in, then the innovations that you work on become a lot easier because you're able to tie it up together. So all of this is to drive around one key area that almost all the startups that I work with get wrong. And they believe, and that is that they believe they have a customer. You don't actually have a customer. You have three constituents that you're dealing with. And I just call this a little PBU constituency. The payer, the benefitter, and the user. Most startups, most people working in innovation teams have a pretty good idea about the users. They look at the users, they understand who they are, etc. What they get absolutely wrong in most cases, and this is why in health startups aren't as successful as one would like them to be. In other industries, the reason why you can disrupt so much faster is that the person using the system, and the person benefiting from the system, and the person paying for the system, or the company using your software, and the company benefiting from your software, and the company paying for your technology are usually the same. In healthcare, they're almost never the same. So in this case, as you're coming up with your brilliant ideas, have you laid out and said, well, these are my users, these are the people that are going to benefit from it, and these are the payers of it? I mean, think about why is the government having to give out billions of dollars in incentives to get electronic health record solutions? because they don't benefit the guy doing the data entry as much as payers and other groups. Now, once we align those things and get it to where the payer and the benefiter and the user are roughly equivalent, you're going to see a much faster adoption of many of the technologies that we're hoping get adopted. Let's not kid ourselves. Everybody raised their hands about their mobile use, etc., but most of you are not using your mobile phones to help you manage health in the same way that you use it to help you manage your email. Let's not kid ourselves that we're using it to help us get better fit, etc., in the same way that we use it to connect with our wife and see what we need to pick up at the end of the day through SMS. So this is what the problem is. We're kidding ourselves into thinking that we're a lot further along than we really are because we don't understand the fundamentals of why businesses work the way that they do, and then why does it not work in healthcare. It doesn't work in healthcare not because we're stupid. It's because we have a much more complicated industry. We're 3 times bigger than the next industry at our size, at the $3 trillion size. And you have to make sure you understand those nuances.